before conception that gets translated into the conception period, then even medications become a challenge.
Is it true that the mother's emotional state can affect the baby's future mood?
Definitely yes. Because this is a period where, there are a lot of hormonal changes that happens.
What are some early signs of antenatal depression or anxiety?
The first symptom that you would see is overthinking. The symptom becomes worrisome when the woman constantly overthinks about it.
So this is a similar screening tool applicable for all women.
There are some questions which are exclusive for pregnancy. For example,
Welcome to Feminine Systems, the podcast where we not only heal or empower women, but also reimagine systems around her. I'm Dr. D, an integrative gynecologist, an author and an entrepreneur. Today's guest is Dr. Parvathy, who is a consultant psychologist at Sri Ramakrishna Hospitals, Coimbatore. She is specialized in perinatal psychology, anxiety and depression. She has successfully counseled more than 3,000 executives in more than 20 organizations on various personal and work-related concerns. She is a subject matter expert who has delivered over 200 talks and conducted over 350 workshops on mental health. She is a trained and certified clinical hypnotherapist. She is a certified cognitive behavior expert. She is also a certified lactation counselor. In today's episode, Dr. Parvathy will uncover all the mental health issues associated with pregnancy and postpartum. Welcome, Dr. Parvathy, to the Feminine Systems podcast. This is one of my very close to heart topics, mental health and depression in antenatal and postnatal period. So going on to the first question, Dr. Parvathy, we often screen for anemia and BP during pregnancy. But what about mental health?
Mental health during the antenatal and postpartum, I think, is not the regular normal part of the checkup. So what happens is most of the time it gets missed.
Right.
And we see that antenatal is the period where this mental health evaluation becomes very, very important, because this is the most crucial phase of, life transition that a woman goes through. So there could be many predisposing factors like previous abortions or, infertility for a long period of time, or maybe expectations from the family. So there are many, many factors, and however the strongest the woman is, childbirth would induce some amount of anxiety. The idea of pain, the idea of the antenatal, vomiting and other thing that's associated with pregnancy, and lot of overdose of social input about how it is important for a pregnant woman to be or to exist. So, there will be a lot of
advices. Everybody has their
lot of advices. So actually, antenatal counseling means a lot of myth clarification.
Right.
Myth busting.
Right. So, what is the incident and what are the most common antenatal mental health disorders that occur?
The common antenatal adjustment disorders that we see is most of the time anxiety. Because the first 3 months especially is a stabilization phase where the women goes through a lot of turmoil, hormones play havoc, and she has to cross over episodes of maybe hyperemesis, and she has to cross over adjustment issues, and food that she used to love probably
completely sometimes changes, right?
Yeah, completely changes. And food that she didn't choose over anything, probably she will now be forced to eat.
Right.
So, and there is a lot of life changes that happens, and because of internet and social media, there is an overdose of information about pregnancy. So somewhere subtly it all creates a sense of doubt, and this is the time where she is also very vulnerable. So that's the reason why commonest that we see is antepartum depression, and we also see an anxiety.
Okay. In postpartum?
Postpartum is a whole changeover, like CSK match and suddenly Dhoni gets into batting. So the postpartum period is like that. So in postpartum period, there will be an attention shift from this woman to the child. In antepartum, all cameras on her, the spotlight is on her, and she means everything. In postpartum, everybody's on the baby, everybody is enjoying the newcomer and the family, everybody is about childbearing, child rearing, and lactation, and there's nobody to even, very few to empathize with what this woman is going through.
Right. They say actually this mental health issues affect 1 in 5 pregnancies. It's so common, almost 20%, which is so still it is underdiagnosed and ignored, be it in the hospital setting, be it in the family members. People don't understand the seriousness of these issues. How do we differentiate these hormonal mood shifts from clinical depression in the antenatal period?
Actually speaking, the role of prenatal counseling becomes very, very important here. So we call it the preconception counseling. So when the couple is planning for pregnancy, it is important that they come for counseling and they understand how this whole trajectory is going to be, because this is one experience which is unique to every couple. You cannot generalize. Oh, my pregnancy was like this, the same would be yours. No,
two pregnancies of mine will not be... Two
pregnancies of the same individual itself, there will be a sea change. So this preconception counseling is very important, where we prep them. Yes. Right. And in preconception counseling, when we get to analyze the couple, we understand about the barriers, we understand about the cultural shifts, we understand about anxiety that she is carrying, we understand about the subtle pressure that gets translated into stress, maybe from the extended family members, within the family, subtly from the spouse also somewhere. And this is a period where it is an opportunity for us to educate the family that what kind of attention and emotional support matters. So the preconception itself becomes very important. And when it comes to antenatal, it becomes very, very important for just to make the family understand about what is their upcoming role.
Right.
And how they can take responsibility, how they can relieve, post-birth, some time and space for the women to recuperate. And it is very important and to even see if there is any predisposition factors like baseline bipolar disorder, sometimes schizophrenia also in most of the case we see. So the challenge here is when she's going through any of these psychiatric presentations even before conception, that gets translated into the conception period, then even medications become a challenge. So this is the space where early intervention is very important, because it does affect pregnancy, it does affect the quality of your pregnancy, and of course the development of the child.
Do you see this as very hormonal because of the pregnancy changes, and then postpartum because of again the hormones?
It is very important that she presents for an evaluation where a mental status examination would be able to differentiate between hormonal and an underlying psychological issue. Yes, so we have come across women who have shown just hormonal differences. We have come across women who have shown classical psychological presentation. And in India, because it is still a taboo to talk about it, most of the time there is a huge gap between the marriage and pregnancy, where this underlying cause was just dormant. And now when pregnancy has come, just triggers. Okay, so it's very important for the women to be transparent, seek help in confidentiality if she thinks she has a predisposing factor, or if she is also experiencing any sudden onsets of symptom, earlier the better.
Yeah. Is it true that the mother's emotional state can affect the baby's future mood?
Definitely yes. Because this is a period where, there are a lot of hormonal changes that happens, and it's important how the mother handles the stress dictates how the baby is going to handle stress, because our stress handling ability is actually, inherited from the mother. So that is the reason why we say the mother has to be very positive at the end of the day. And intrauterine, there's a lot of mirroring that happens. So if the mother is like constantly agitated, not taken care of, not well nourished, there's no self-care, you will see the cortisol levels increase, and you will see the baby is also, quite disturbed. The baby is also very, hyperactive, and you will also see the nutrition, the emotional reassurance, and of course a lot of empathy is important, which keeps the mother calm. Calmer the mother, happier the child.
What are some early signs of antenatal depression or anxiety that families or care providers should watch out for?
The first symptom that you would see is overthinking. So there will be a lot of worry and anxiety about the pregnancy. There's a lot of worry and anxiety.
Is it
about,
really worrisome if the symptom is a very worrisome symptom?
The symptom becomes worrisome when the woman constantly overthinks about it. She's not able to get through it. She's either obsessively questioning.
Because as an obstetrician, I used to always feel most of the patients are overthinking during that time. They read a lot, they Google a lot, and so many inputs from others, and they're constantly anxious. So where is that line, and how do even family members really understand this is a first sign of antenatal depression?
If the woman is not able to enjoy doing tasks she normally used to do, if she's refraining from social contacts, if she's refraining from communicating her feelings openly, and there is a sudden loss of appetite, there is insomnia, and there is an obsession worry about how the whole trajectory of pregnancy is going to go, and there is a compulsion to be the best mother. And very, very early symptoms that we could see would be, obvious symptoms that we can see would be self-doubts.
Yeah. Am I good enough? Will I be a good mother?
Yes.
These things.
Yes.
These are actually hidden signs of depression.
Yes.
And as you said, will they be crying for no reason? All this can happen?
Yes. When the mood shift happen, even in pregnancy, you have the hormonal phases. You have the estrogen phase, you have the progesterone phase. And you will see while this hormonal shift is happening, there will be a lot of mood swings. And this is the time where it is, the bonding between the mother family and the baby is very important. So there are very, very healthy practices where we do bonding techniques with baby. You would have heard about Garbha Raksha.
Yeah.
You would have heard about, a lot of such spiritual practices also, which play a very dominant role in making the mother calm and connecting well with the baby. Yes, not just the mother, but all of these rituals also involve the extended family members, so that the mother is reassured she has everybody with it.
Right.
Yeah, and you will see that the hormonal phases that the mother transits, there will be a lot of mood swings. The first phase she would hate to eat, second phase she'll love to eat, the third phase she'll crave to eat, and the fourth phase she'll be forced to eat. So this is the trajectory how the mood shifts happen. And as she's approaching in the mid phase of pregnancy, she will actually be very strong and she will try to connect and bond with the baby. Beyond 5 months, when you feel the fetal movement, it reassures the mother. So anxiety comes down during the phase. But as she's approaching delivery, that is the phase where she needs a lot of reassurance.
Since this antenatal and postnatal mental health issues are so common, 1 in 5 women experience it, are certain group of women at a high risk for developing these conditions?
Yes. Some women may have a predisposing anxiety disorder, or may have depression, or may have obsessive compulsive disorder, or may have any of those personality disorders. And when they abruptly stop consultation or they abruptly stop medication just because they will be judged at their marital home, you will see that it bursts out. It sometimes catastrophes when it comes to pregnancy. So it's very important that when you know that you have a predisposing factor, it's always good to clear it up preconception, so that
right.
we
so
can
previous
take
history of
yes,
any
yes,
health.
Yes, there is
Any
no
other
point in brushing it under the carpet, because ultimately it's
we
going to
just
hit
want to
on
get
your,
her married, and
Yes, yes.
that happens. So
Yes.
many a times this is not so uncommon in India. Many health disorders are hidden.
True. And it is
Right.
very important for them to speak up, at least take their gynecologist into confidence and tell them.
Right.
So that, they will be confidentially, or they would be guided to the right person at the right time to seek help.
Right. And sometimes even factors like lack of emotional and help at home, as well as some if there were any financial difficulties, burdens, or sometimes domestic violence, all these can also trigger.
Definitely, it will trigger to a great extent. So this is a period where what I would suggest is, even before you plan a pregnancy, if you have any of these factors in your life, if you can open up and talk to your therapist or to your physician, it will help them to advise you if this is even the right time to think about it.
Right. So when do you think is the right time to do the first screening? Is it like when you're first pregnant, or even before in preconception?
I think personally the first time to do the screening is preconception.
Right.
Especially if you have a known case of any psychological distress.
Right.
But even otherwise, preconceptually, if you take a therapy and if the myths are busted, you will see that you will get into this whole transition of pregnancy well informed.
Right. But not many are prepared for this preconceptional, counseling of. There are a lot of people who go seek IVF treatments. I think that itself is a risk factor I always see, right?
Yes.
Because they're very anxious for that baby. That has a toll on their emotional health, because
Yes.
a lot of societal expectations are set. And when they face a miscarriage, again, they have a significant amount of anxiety and, so many challenges which, they again don't have the space to come and talk when they come with the entire family to the obstetrician, right? The entire family comes, they are very hesitant to talk about it, and they really brush it aside. So how important is this preconception consultation and counseling in terms of mental health important?
Very important, because when the woman comes with her card and it says that she's pregnant, you will see the whole family with her. They are very enthusiastic about this. They come and they discuss with what can they give her, how they should be taken care of, and everything. But unfortunately, when a woman goes through a miscarriage, it's only the woman who comes for the consultation.
Yeah.
Most of the time we see the spouse, we largely see the family missing.
No, it is not even informed to everyone,
Yes,
right?
it's not even informed
early
to
miscarriage,
everyone.
it's not been told.
But that is the phase where the woman goes through a lot of emotional turmoil, because when she comes here, there are a lot of things that goes into her mind. Where the women always process it as her fault.
Exactly, guilt. I didn't eat properly, or I did something that
Yes.
harmed the baby, or
Yes.
maybe
Most of the time I have women who have even cried saying that I'm not lucky to bear a child. And most of the time women have cried that I am not destined to gift a child to the family. So this is the time where she's at the peak of her vulnerability, and if this is not addressed at that point of the time the right way, this is going to get into her future pregnancies,
right,
complicating it largely.
And that anxiety at that next pregnancy also is very significant.
Yes.
After a miscarriage. How do you approach therapy for a pregnant woman experiencing depression or anxiety?
We start to take a mental status examination. We also look for any predisposing factors of psychological distress. And the first session is always, with the family to understand context setting, expectation setting. And then we give time for everybody to address their concerns about pregnancy or whatever they've been through Google or ChatGPT. So it's like a myth-busting session. The next comes with the couple. The next comes with extended family member. And then to the women, where we teach her about the importance of self-care also without being codependent. And while she's a great mother, it's also important that self-care during the maternal period is very, very important, and not to feel guilty about taking the me time. So we prep her through the phase of pregnancy, we prep her for the postpartum period, and we always tell her that you don't have to do it all by yourself, and why it is important to outsource help.
True.
And every woman wants to be a perfect mother. So here we, try to understand what is the benchmark for perfection, and we try to normalize it.
Right, because somehow there is a lot of pressure, of wanting to be the best, perfect, idealistic, right? It's so, that itself is a lot of pressure on oneself. You're being unkind to you, right?
You'll be surprised to know that most of the time when we do antenatal counseling, we have always heard women talk about their trauma. The mother wound trauma that they're processing, the father wound trauma that they're processing, the financial insecurities they went through, loss of parent, absent parent, single parent, So they would talk about their childhood adversities, and they would actually be very overprotective that something like this should not happen to their children. So this is the time where your mind...
So we can rightly call these any childhood trauma is a risk factor for...
Yes, certainly. Because this is the vulnerable phase where the childhood trauma would, just recap in your brain like a documentary.
Right. So, and they become overprotective.
They become very overprotective. They become hyper-vigilant, and they become over-anxious.
Right. Which is neither good for them or the baby.
Yes.
In a way. And it starts with this resurfacing of these past trauma. When does it become a full-blown depression or psychosis?
It sometimes becomes a full-blown depression or psychosis beyond 5 months of pregnancy. And sometimes it catastrophes and there is a volcano that bursts immediately postpartum. But you will see that it's like a dormant volcano where the fumes would start releasing antenatal. When they are not addressed at appropriate time, then you have the volcano bursting postnatal. And it becomes very difficult when it bursts postnatal because, there is an enormous amount of dependence on you because of your self-care, and there is another dependent child.
Right.
Yes, you're physically, emotionally vulnerable. So that is why it is very traumatic. And what burst during your postpartum phase gets registered. And you will see this will hit your menopausal anxiety.
Yeah. It's like you carry it forward.
Yes.
Right?
It's like a baggage,
yeah,
and you carry it forward.
And especially it surfaces always during times of vulnerability. And women experiences such phases of vulnerability throughout her life. Like, once she enters a pregnancy, then in the postpartum again, she feels okay. Then after, when she hits a, perimenopause, again, all this is...
And I think that was very important during this pregnancy phase to, even educate the women about what it means to give a realistic support versus dramatic attention. So...
Could you explain that?
Some women feel happy during pregnancy if there is, some, genuine care. For example, have you eaten a nutritious meal today? Do you have cravings? Would you want me to order something for you? Okay. Would you want me to give you a massage? Probably.
Yeah.
And would you like to watch any movie together? Or would you, can we go to a parenting class together? Something like this. And just the family member asking, I would take care of the domestic chores, you can rest for a while. Okay. These are normal attention. Versus, movies and media has created a benchmark for dramatic attention. Like, celebrating with pomp. There is a lot of get-togethers. There are like, of course, in the West you have gender reveal and all that. Not in India, but so what happens is sometimes during the vulnerable phase women tend to compare.
No, I even see this photo shoots and all that. Adding, is it sometimes there is a moment to cherish, and of course I'm not against or for or anything. But absolutely. I'm like, sometimes some people take it as a peer pressure to do
exactly. There's a peer pressure to do it.
And it is more like as you said, more dramatic to even show that on your Instagram. If you do a shoot, okay, well and good, have it for you and cherish it for life, right? Does it is it Instagram worthy is what sometimes I was, is it really needed? Because are you really, see, to do a photo shoot is not the problem, but to, kind of, so this is a little dramatic, right? Like
this is a social benchmark which is set recently, which also causes a subtle pressure.
And some people, they don't make you walk also. No, you should not
Yes.
walk fast.
Yes.
You should not, take a, go. The drama comes like, no, you should not at all travel, all those things, right? Like,
Yes.
but real care, they really fail.
True,
Right?
True.
So
That's why I told you the whole session starts with myth busting, especially fertility treatments. There is a lot of myth because
Correct.
it was a precious pregnancy, you can't walk, or it's a precious pregnancy, you can't stand for a while. And what happens is the women becomes very sedentary,
correct.
not by choice but by force.
Right.
So you will see that when the moment you become sedentary, every other mental distress will start cropping up.
Very much. Very true.
Unless it's medically advised.
Correct.
Yes.
Because daily walking is so encouraged, minimum that, and even there are certain exercises which really help, which improves your insulin resistance, which is a normal thing that happens in pregnancy. And pregnancy per se is a risk factor for developing gestational diabetes in an Asian woman. So in that sense, at least some physical activity
True.
and exposing yourself to sunlight, this can actually
Yes.
improve your
Yes.
mood, right?
Yes.
Could you give me 3 rituals which can improve maternal mental health?
The first is introspection. This is a time where, all the calming techniques help you. So whatever you feel like, for example, mandala art, some women feel super comfortable when they play with colors, they do mandala arts. There are some women who have told me, just binge watching probably relaxes them. Some women who have told them that, a conscious eating and a nutritious planning relaxes them. Some have even got into networking. Some have even gained new skills like art, long lost, painting, poetry, writing, blogs. So this is the time, the first 3 months is the time where you have to, explore how you want to take the whole journey of pregnancy.
Right.
The mid-cycle are the 3 months where you have to explore about self-care. You have to explore about planning for your pregnancy. And the last 3 months is the phase where it is very important to prep yourself and prep your family members for the new arrival. The whole spiritual journey is also set that way. Why we do this God Barai, or you call the Valakappu festival of Tamil Nadu during the 7th month, because that is the time we feel the woman is matured, well informed and looking forward. Hormones have changed. She's got back her taste and there's no vomiting anymore and she enjoys food. And that is why you make, you cook all her favorite. And that is the time the brain development of the child has formed and the child wants to network with people, men, women, children, come to this festival and you will see the child bonding with them well. So the child is also introduced to sounds and conversations even before the child is born so that it is well informed, doesn't cause anxiety.
Right. How common is postnatal depression and how does it typically present?
1 in 10, I would say, go through postnatal depression. But I would say 1 in 5 go through postnatal blues. There is a difference between postnatal depression and postnatal blue. If you feel low, you feel very underconfident for the first 2 weeks of your delivery, and slowly you start to gain confidence and you're able to handle it, get into a normal mode and start functioning, then we call it blues. But if it is extending beyond 2 weeks, where it is debilitating, very, very debilitating, where it causes insomnia, you have cry spells. Sometimes you also get vision of harming your baby. Sometimes, it even goes to the extent of imagining yourself absent, so, and not confident to handle the baby, fearing that you would cause damage. self-doubting, reassurance
Sometimes you harm your
seeking.
baby also, right?
Definitely.
The,
Postpartum is that
depression,
dangerous that sometimes it can
crying,
trigger.
fights
Yes.
again. Sometimes, you can actually, there are instances of, inflicting trauma to the baby. Sometimes some people throw the baby. These are, if somebody does that, they need professional help. Don't, kind of fight with her more.
This is why starting it early becomes very important, because for a psychologist also there is the boundary up to which we can work. When we understand that this is going beyond boundary and we sense this risk of happening, we would also have a psychiatrist into the loop. So the whole antenatal period is supported by the gynec, by the psychiatrist and by the psychologist. Sometimes some women need this extra care.
Correct.
Okay, so the role of these specialists act as a cushion, and at the end of the day, what matters is giving her a very comfortable transition into a new phase.
What are the warning signs that a new mother may need mental health support?
Persistent crying is one warning sign. Persistent self-doubting. Isolating herself from the baby. Yes, and sometimes feeling chronic fatigue syndrome.
Yeah.
Yes, sleep deprivation, anger, irritability, sometimes explosive anger, and acutely it could be even disassociation, hallucinations.
I think the family has to be prepared for this so much that these are the things, changes that can happen during pregnancy and postpartum. Are you ready if in case your family member goes
exactly through? And the family also needs to be educated that this could be a sudden onset also without being previously symptomatic.
Right.
So non-judgmental approach to these symptoms are very, very important. That needs to be educated to the family.
When does it become a medical emergency?
It becomes a medical emergency when there is a threat to life, either for the self or for
baby.
others. Okay, so that becomes a medical emergency. It's a medical emergency when there are sudden onset of seizures, okay, or there is a sudden onset of total neglect, self-care and care for the baby. Yes, and
this is one common symptom I've seen many people go through, right? That neglect.
Yes,
and people just pass a blame game on the mother that she is not caring for the baby enough. But really what she goes through is a very organic issue, which we just say you're doing it voluntarily, or it's not even under their control, right?
You will see these symptoms are magnifying, especially when the woman is very early into lactation. Because the moment baby cries, the instant knee-jerk reaction for the family is the baby is hungry, feed. So mother is expected to be available all the time for feeding. Okay, so this is where it is important for us to educate feeding interventions. This is where it is important for us to educate alternative feeding interventions, like not just direct breastfeeding but also encourage express breastfeeding. Okay, so this is the time where we have to educate the family that they can also care for the baby, they can relieve the mother of her care.
Because we emphasize early breastfeeding,
yes,
maybe because we don't want the child to miss the colostrum and all that. But as you say, that at that phase when the body is getting adjusted and they're recovering in that postpartum, they need some dedicated baby support that which will help them nurse and take rest simultaneously in between.
Actually, mental well-being during this phase is only going to support the women with continuous extended period of lactation.
Absolutely right. Else, the first thing, anytime, I think the biggest when their moods are so low in case of a postpartum blues, the family members come to her, keep saying the baby is crying, come feed.
Yes,
it's like forcing her to feed.
And
everybody
most of the time there are women who have even complained that the family member says your feed is not adequate.
That is the most commonest self-doubt, as well as the family.
It's a very traumatizing statement to the new mother, know. And even during pregnancy, there is one common thing I would say is during pregnancy, the lady is forced to eat well, because they say, there are two lives.
Yeah.
So these kind of pressures do
Pregnancy
exist.
time, you need to eat more. Again, lactation also, I'm telling you, they give you certain foods which you don't like, saying this will improve your milk, baby's milk, will improve quantity of milk, and force feed you. And apart from that, every time a baby cries, it is not necessarily hunger.
Yeah,
The
definitely.
baby's communication language is only
Yes,
crying.
crying.
So at that thing, it just needs, maybe a baby needs a pat and walk sometimes,
it
carry
needs
it.
warmth, it needs reassurance sometimes. It needs to be attended.
Correct. And sometimes it could be, it could pass a urine, simple things, okay?
Yes.
And, but even sometimes a colic, which is like, no, the baby is hungry. The baby is hungry. It's a lot. And the mother feels so guilty. Oh my God, I'm not able to produce so
Exactly.
much. You will start producing adequate milk by 3rd month when you are into that the pattern of regular feeding.
Yes.
The baby will suck and take as much as
Actually,
milk
the
needed.
mothers and the family should know that babies catch patterns beautifully.
Right.
Yes, they have times when they wake up, they have times when they go to sleep, they also have times to give hunger cues, they also have times where they just let the mother be.
Right.
The baby is actually quite independent to handle the mother and itself. So it is just that underestimation of what it could do.
Right.
Gives a lot of stress to the mother.
The family gets panicked and they thrust it on the mother.
Yes.
What interventions are most effective for treating postnatal depression?
The intervention during postnatal period is, again, giving a clarification about cues of baby, insisting the importance of self-care, bringing back the women into her routine. Yes, and again, understanding what is the benchmark or expectation of the women about her newfound role of motherhood, and trying to clarify what is the boundary.
That's something most people don't respect, right?
Yes.
So, how do cultural beliefs or stigma affect how women seek help for depression during pregnancy and postpartum?
It does affect a lot, because the moment we say that during pregnancy and postpartum, the mother needs therapy, the mother needs to visit for therapy, there is a big constraint which says, oh no, she has to be available for the baby, she has to be available for nursing, she has to be there because the baby is there at home. Okay.
No, there are many families which don't, the baby and the mother, they are not going out.
Yes, they don't go out
for a couple of months, right?
Yes, right, true.
So,
and also culturally, there are a lot of rituals that happens post a baby's birth, where the mother has to, in spite of law, dress up and be, social and gregarious. I think this is the time where the family should also assess if the mother is in the real mental health picture to go through these rituals. And I think until the mother and the baby becomes comfortable and adjusted, rituals can be reconsidered.
what mental health screening tools do you recommend during the perinatal period?
We do a perinatal mental health questionnaire, and we also do a PHQ, which is a perinatal health questionnaire with Beck's depression interview, and we do a technique called motivational interviewing. So in motivational interviewing, we ask about how the life of the women had been and what were her fear factors, what are her doubts, and we also help the women to verbalize her anxiety.
So this is a similar screening tool applicable for all women, right? Or
there are some questions which are exclusive for pregnancy. For example, if she had had a previous miscarriage, or what kind of support she has from her family. Is she going through any distress like domestic violence or any other issues during pregnancy? So how is she enjoying her pregnancy? Most importantly, is she looking forward for the motherhood, the role of motherhood? Yes, that is very important, because among the 100 women who enjoy motherhood, there may be 10 women for whom this pregnancy possibly could be unplanned.
Yeah, very true. And do you think the families and the current medical system is prepared to handle maternal mental health issues?
Perinatal mental health is a very growing topic in the West. In India, you see, it is not still catched up. Okay. And what I think is during the antenatal checkup, at least one in a trimester of mental health support is very important.
So you recommend a screening with
A screening with
at least once in pregnancy.
Once in pregnancy.
That much I think.
That much
because
is the
once in a
minimum we can
trimester is a bigger ask.
No, because every trimester, the mood swing changes.
Right.
And
that's more idealistic.
Yeah, that's more ideal. But at least once antenatal and one postnatal.
I think women should themselves demand for it.
Yes.
Right. Let me go through it so that
Yes.
I understand where I am standing.
Yes, exactly.
So am I at a risk for developing someone? So if I'm susceptible, I should be equipped better to handle it.
Exactly.
Right. So this is something.
This is just a protocol of having an informed care.
Right. And most women think they are not, they might not go through some mental health issues. No, that is actually wrong, which I feel.
No, that's
anybody and
everybody is vulnerable to it.
Right, right. So, could you give some hacks to educate the spouse about maternal mental health?
When I suggest that when the spouse come for treatment, when the spouse come for treatment in case of fertility, we do talk to them about how they would process. I vouch men mental health equally important like the women mental health. Okay?
Yeah.
So this is an area where not just the mother but the father would also be equally anxious because it's a transition to the father also.
Right.
Yes. So he needs to be educated about his role. He needs to be educated about red flags. He needs to be educated about pink flags. He needs to be educated about if something like this happens, what
are
should
the
be
pink
his...
flags?
Okay. The pink flags could be not risky but moderately risky. For example, red flags could be somebody talking about self-harm, but pink flags could be, hey, you know what, I'm tired. Could manifest into a red flag. Are pink flags.
Right.
So it's important to educate them, and it's also important to educate the extended family members on how they can support, because it's a whole new generation. This generation are more informed, and as I told you, because of overloaded information, it's very important to declutter.
Right. Very true. Now we're going to my favorite part of the Feminine Systems podcast, the rapid fire round. Most underdiagnosed mental health symptom in pregnancy?
Most underdiagnosed, I would say, emotional numbness and crying.
Most overused advice you hear given to sad new mothers?
Sleep when the baby sleeps.
A warning sign family members should never ignore?
When the woman has an idea of guilt or thought of worthlessness.
One book or film that every mother should watch?
I would say whatever you're able to connect yourself with.
Yeah.
And I would, I have heard most women enjoy this movie called Badai Ho.
Okay. So,
it's a beautiful movie.
I've written a book on...
It talks about the whole family catching up with this aged mother.
Okay, interesting. Yeah. I have written a book called My First Pregnancy.
Oh, wow.
Yeah, so it's about my pregnancy journey.
Very nice.
Something which is which somebody can relate to their own first pregnancy.
Is writing a book on my first pregnancy.
My story, and then it with some importance for mental health rituals.
Great.
And
I would read it.
It's available on Amazon. So, one cultural ritual that actually helps maternal emotional healing?
The postnatal massage, the postnatal conscious dieting, okay? The postnatal nutrition she gets, and of course, a lot of care and attention.
Yeah. Is medication safe for postpartum depression during breastfeeding?
Yeah, there are certain medications which are safe, and it's very important to take medications prescribed by the specialist.
If you had one wish for the future of maternal care in India, what would it be?
I would feel mental health should be a part of the routine checkup.
Yeah, very much. And there should be insurance coverage for it.
Definitely,
as well, right?
Yes.
Sometimes, especially postpartum care.
Yes, definitely,
right?
definitely.
So one thing. And have you seen women in pregnancy and postpartum with suicidal thoughts, and how do you handle them?
Yes, we have seen women confessing about self-harm, and that is the time where we refer them to the psychiatrist, and the psychiatric intervention comes into the picture, where the medical part of the intervention comes into the picture. Okay. And it is not just psychiatric intervention, it is also about the extent of CBT that we have to increase for the women to help her get out of this sense of hopelessness.
Okay. Thank you, Dr. Parvathy. It has been a very, very insightful session. Despite being a gynecologist myself, a mother, and I have gone through this postpartum blues myself. It was so different. But still I was not prepared for it myself. Despite my pregnancy was after my MD. So being a gynecologist, I became pregnant for the first time, and then still I was not well prepared for it. So at that time, these kind of talks and classes were very limited when I had some 14 years back. So, but now it is much, people should opt for, such options which are available to know where they stand, and they can reach out to help when really needed, because you learn to swim well when you learn swimming and you enjoy the ride, basically.
With the fear of water, you can't swim.
Exactly. So else it is just you're being pushed into a big sea.
True.
It's a very, once you know you're prepared and know the skills, then it's like you can take it for a ride.
Definitely,
and have a very beautiful journey, because so many different phases, something what women go through, and our education system as such doesn't train you for these are the life skills and very important aspects which you're not prepared for.
Yes, because this is going to totally translate into parenting in the future. So it's very important that you have a great start.
Right. So thank you so much, Parvathy.